In Haiti, doctors and nurses are sometimes just showing up on what passes for a makeshift medical clinic and asking, how can I help, and then getting put to work. Our own chief medical editor, Dr. Nancy Snyderman, went to Haiti to practice medicine, as she has done overseas before, and told us she would fit in her reporting duties as she could. Tonight, she has a story about how one nation came in there and set up shop almost instantly. Nancy, good evening.
Good evening, Brian. Within 48 hours of last week's quake, two 747s arrived in Port-au-Prince from Israel, one loaded with medical supplies and the other with personnel, here to create the best field medicine available. Just outside the airport, on the grounds of an abandoned steel factory, is a temporary hospital, not hindered by roadblocks, not reliant on outside aid.
We are bringing some supplies from abroad in order to be self-sufficient, and we are managing well here and trying really to assist the people and to save lives.
What the Israelis have brought is the model for medical disaster response. When patients are checked in by the nurse, they are photographed and an electronic medical record is established. And you have electronic medical records.
Of course, yes.
Of course.
All kind of images.
For those who need an X-ray, sophisticated digital pictures are captured and wired to any unit that needs to see them.
More than that, we can optionally connect the system to the wire and send the pictures to another country. We can consult with him phone, and he can tell us what he thinks, what his opinion.
While the operating room stays busy, so does the intensive care unit with 4 ventilators available. There is even a neonatal intensive care unit that can handle Haiti's most vulnerable. This father keeps watch over his newborn, the only one of triplets who survived. The decisions made in this mobile hospital are medicine's most complicated, and agonizing decisions are made every day. But the mission is clear.
And when we save lives of one person, we feel that we save the world. So we save the world several times in this mission.
There is an ethics committee that's part of this team. They talk about the agonizing decisions they make as to who lives and who dies, and a psychiatrist who is there to deal with the stress and the trauma that the doctors and nurses are under. Brian.
We watched the Israeli team arrive before we left Haiti. Nancy, fascinating to see what they set up there on the ground. Nancy Snyderman in Port-au-Prince, Haiti tonight.